Leading High-Performing Healthcare Organization is a program offered at the Strathmore Business School, Madaraka campus. The program, which was run in collaboration with Management Sciences for Health and the sponsorship of USAID, explores the diverse and complex challenges that confront regional healthcare leaders. It also imparts the skills and frameworks needed to implement new processes, organizational designs, and leadership strategies. The participants of this program are engaged and usually tasked with the responsibility of coming up with a project that will improve healthcare delivery in their various workstations. Sabatia Eye Clinic, based in Vihiga County, is one of the hospitals that has experienced remarkable improvement as a result of LeHHO. The staff members of Sabatia Hospital are now motivated than ever to work at their optimum because their leader is the first team player.
My name is Ernest Orlando. I'm a pediatric ophthalmologist and I work at Sabatia Eye Hospital. I also double as the medical director and CEO of the institution. Our LeHHO project was increasing the bed capacity of the hospital. This hospital was built in 1996 as a 33-bed capacity hospital. And at that point in time, we had a small patient population, but this population has grown over the years, and so much so that we didn't have enough accommodation facilities for our inpatients. And so we sought to increase the accommodation facilities and make them better in the process so that the patients could have a better inpatient experience when we admit them for surgery.
Elsewhere in Kisii Teaching and Referral Hospital, the story was no different. The LeHHO project that took place in the hospital has not only transformed the operations of the pharmacy, but it has also greatly improved the ambience of the hospital. The program made it easy to harmonize all the expectations as well as to deliver them, especially at a time when Kenya is grappling with the issue of devolution.
My name is Sarah Omache. I am the County Minister for Health for Kisii County Government. We wanted to make sure that we would work in our pharmacy here to make sure that we have a system that will tell us surely that the drugs we bring in are dispensed well and that there is a good supply of it.
Tenwek Mission Hospital in Beaumont found themselves in a situation where the patients were not paying for the services offered. Because it is a mission hospital, they assumed that treatment and medication would be free of charge. Therefore, the project in this hospital was to improve debt collection.
My name is Raymond Biagon. I work as hospital administrator. Our project was about debt management. We actually chose all this because we wanted to improve on our debt collection.
More often than not, when the right structures are not set in an institution, there are bound to be a number of challenges in the matter of procedure and operations while working. Ritan Jeru, the nursing officer at Embu Level 5 Hospital, appreciated the spirit of teamwork that she learned from Strathmore Business School while attending the LeHHO program. For her, transformation took place in the heart. After the LeHHO program, she gained a positive attitude towards her work, and she now manages her colleagues with virtue.
I'm Lita Kawiranjiro, Mrs. I'm an Assistant Chief Nursing Officer in Embu Level 5 Hospital. Our LeHHO project was in developing standard operating procedures in procurement process.
One of the major complaints in most hospitals is the waiting time. Nairobi Women's Hospital, Adams Arcade branch, sought to rule out this problem. Dr. Felix Wanjala, the Chief Operations Officer of the hospital, together with his colleagues in the LeHHO class, decided to do a project on system standardization. They came up with a policy in naming, pricing and removing of irrelevant information from their systems.
My name is Felix Wanjala. I am the Chief Operations Officer of the Nairobi Women's Hospital. Our LeHHO project was about system standardization. We were standardizing the naming, the pricing, and then we had a lot of information in the system that we removed from the system.
It's important to ensure that you pay your bills for the hospital to be able to be sustained.
There was a lot of delays.
The reason why we chose this project was, first of all, the frustration, because the system used to be down between 10 and 4 p.m. every day, and those are our peak working hours.
So that there is accountability on the way the drugs are being used, and the patients also. I believe that the complaints that there are no drugs and then we have no real answers to give will cease. And the patients then, of course, when they get the medicines that they need, will be happy.
We didn't have enough information.
The procurement process.
First of all, they don't understand about the hospital.
We didn't have a budgetary allocation for this project.
So money was a challenge.
We had no funds.
It's time.
We are in very, very busy offices. Challenge of when could we meet to do these things? We decided to do it early in the morning, every day.
We made it to be part of work.
It had to take lobbying, discussing, talking about it, saying it's limited to the time that we are in class.
The challenge of money, we had to convince the board that if we got a new server, we are going to have a shortened time of serving our client, and this was a key selling proposition for our client, that they could come to our casualty and spend 1 hour or less for outpatient services. The faculty was some of the best that I've come across. They were very helpful. They made sure we had understood. My interaction with them, even off class, was just the best, and even up to now I really appreciate what the faculty did for us.
It was good.
Faculty is excellent. I must say I met some of the greatest teachers who have ever taught me while at Strathmore. They had good mastery of the substance in what they taught, and I felt the passion they have for their work. So the faculty was great, and they are very knowledgeable. And because of the passion they have for what they teach, I'm able to remember so much many days after the LeHHO project.
We really appreciated our facilitators. They were just fantastic. They were not there just to lecture. It was sharing cases, being challenged to think more about it, sharing our experiences.
To me, it was excellent.
It was quite a very enriching sort of interconnectivity of the different approaching.
LeHHO program, actually, I would say, first of all, it was very enriching. We did learn so many things which we didn't know.
My LeHHO experience was life-changing, in that as a person, first of all, I didn't have social and professional life balance. So it was work, work, work. And then we go there, and the lecturers were so good. They taught us how to work-life balance. Now, we learned that, and I realized mine was not a round wheel. Yeah, it was sort of a star. Yeah, so I had to balance this, and this tremendously changed my life, both with my family and at work and in school and financially. So that was a big win for me.
There are very valuable lessons to learn from the other teams as well. And so I can say it was a great experience doing this course at Strathmore Business School.
Meeting the various people who are already working in their capacities as directors, managers of institutions, people from the various hospitals, because it was health.
That's the director who is charged with the responsibility of harmonizing their technical skills towards quality service delivery to our patients. This program has been extremely important. One, I was able to learn that as a manager, it's not that you are a know-it-all.
Before we came to LeHHO training, actually, for inpatient, we were collecting close to 68%. Currently, after the LeHHO training, we are collecting close to 90%.
The experience at SBS is a strong transforming way. That training, I thought, I myself as a person, I had reached the end. The stresses in this hospital, in this where I'm working, they were too much. But the LeHHO in SBS has transformed me from the heart. That I'm now managing with virtue. Not that I wasn't there before, but the degree has changed from around 50 to almost 100%.
In terms of usage of supplies, there used to be a lot of wastages, but currently, after doing that training, we are seeing that the wastage is going down.
Procedures being done well, that the projects, you can see the CT scan project, you can see the theater and ICU project, you can see the lab just where I am behind project and the extension of theaters, you can see the pavements which have delayed over years. Over that or so years that they are coming to be. The LeHHO has to be accredited.
We are now able to know which patient was served and when. And then the pricing also, that has reduced the complaints that we get from clients because of different prices for the same service.
The project has had a great impact in our service delivery. Now we are able to admit up to about 58 patients on any given day, which means we're able to offer surgical services to a bigger number of patients than before.
In terms of my job, I got to learn a lot of management skills and how to balance it out. So because of that, I was promoted from being the chief pharmacist to the chief operations officer while I was still undergoing my LeHHO training.
Because of the LeHHO project, we've had great teamwork. We've shared what we learned during the LeHHO project with the team, and it's been a great learning experience.
The way we were sharing, you see, it enhanced. Generally, I think I'm a people person, but it made me appreciate even more that there is a university that cares this much about developing the person all around and valuing people for what they are.
At Strathmore Business School, we believe in transforming our leaders who in turn transform the societies in which they live and work. With the help of MSH and USAID, this belief has been reinforced and many lives have been transformed.